Tonight, Utah Department of Health confirming a third child has died from influenza during our current flu season. Health experts say this season, well, it's a bit unusual. News specialist Kirsten Nunez joined us live right now to explain why this is happening. Kirsten?
Yeah, Mike, it's been a busy few months here at Primary Children's Hospital, and doctors tell me that it's this time of year where they usually start to see the number of cases start to go down, and they have a little. But what's unusual is now those numbers have plateaued.
I don't think we've ever had a flu like this, where it just knocks you out flat.
Weeks of reaching into the medicine cabinet for anything to help her 5 kids with their fevers, aches, and pains.
With every single kid getting the flu, it was just so long. The longest days of nothing. It was just horrible, and you can't fix it.
And it hit the Burr family hard.
I saw my one son laying on the couch, and he couldn't even move. He couldn't lift his arms. I knew it was serious.
While it got close, none of her kids had to be hospitalized. This flu season, the state has seen nearly 1,500 flu hospitalizations.
It's a bad year. It's not the very worst we've seen, but it's a pretty bad year. And it's been really difficult for the parents and the kids who've gotten bad flu this year.
Doctors say what's unusual is now they're seeing the number of cases stall.
Rates of flu started to go down in mid-January, but then they stopped going down and they've leveled off. So there's still a fair bit of flu circulating in Utah.
As for the value of the vaccine, state epidemiologists say it's well matched to the strains going around now.
When I was seeing a lot of very sick kids in the hospital in January with influenza, not a single one of them had been vaccinated.
And as most of the state is still experiencing higher than normal activity for this time of year, it's not too late to get a flu shot.
And it looks like you may need it for the next 2 to 4 to 6 weeks.
The Burrs hope it comes to an end soon.
Oh my goodness. I do not wish that on any soul. It is horrible, especially kids.
Now, the Utah Department of Health warns that even though we hit that peak back in January, a second peak is still possible, and that's actually what some other states across the country are seeing right now. So they do offer some advice. Get the vaccine. If you have any symptoms, please stay home, and of course, wash those hands. Mike?
Yeah, a lot of people have been going through that very same situation that you just showed us right there. Kirsten, thank you.